Heat's been used for thousands of years for comfort and pain relief and is a first-line drug-free option in recent clinical guidelines. Studies using chemical hot packs showed the value of heat in the treatment of acute and subacute back pain. However, significant questions remain, such as the common effectiveness of heat for a condition as common as chronic back pain, and factors such as time of onset, best temperature, and duration of effect. This study was designed to address some of these questions. This study was conducted in a rigorous, randomized, double-blind, placebo-controlled fashion via contract to Northern California Research Group. Northern Cal follows good clinical research practices, a standard endorsed by the FDA and World Health Organization that ensures ethical treatment of subjects, with benchmarks of documentation, data collection, and reporting standards. No company personnel met any subject, and images of data sheets were forwarded to the University of Washington Statistics Department. Subjects with chronic low back pain were randomized into an experimental arm or control group. All subjects received a medical device manufactured by Suvu Labs Incorporated. The device in the experimental arm delivered heat pulse to 45 degrees centigrade. The control arm received an identical device that delivered steady heat at 37 degrees. All subjects underwent 30 minutes of active treatment and were followed out to 4 hours. 49 subjects were randomized to the experimental group and 51 to the control group. The mean duration of pain for each group was over 10 years. The primary outcome was change in pain score from baseline to 30 minutes after completion of treatment. Reduction in pain was statistically greater in the experimental group compared to the control group, with a p-value of 0.01.
This is a graphical representation of the results. The control arm is in yellow, the experimental arm in red. The active treatment lasted for 30 minutes. Statistical significance in reduction of pain was achieved within 5 minutes of treatment and lasted out another 120 minutes after the conclusion of active treatment.
In conclusion, high-level pulsed heat produced significantly more pain relief compared to the control group in subjects with chronic low back pain. The onset of pain relief was very fast, and surprisingly, 30 minutes of heat provided an additional 2 hours of pain relief. The results of this well-designed study provide insight into the mechanisms and properties of thermal pain relief that are not well understood in chronic low back pain.